Well, people are being turned away from Charlotte Maxeke Academic Hospital. They've been telling us that they were not informed that their appointments had been cancelled. Now, we've heard that there were no working fire hydrants there and that there was a general lack of maintenance at the facility. Firefighters took 2 days to extinguish the blaze there and patients were evacuated from the Johannesburg hospital. They're now receiving care in other hospitals. Gauteng Premier David Makhura announced on Saturday that the hospital would be closed for 7 days. But how realistic is this time frame? Masego Rahlaga is out there for us this morning to find out. Masego, very good morning to you. And I suppose very worrying details coming out about the state of the hospital, what seems like inadequate sort of measures in order to deal with something like a fire at a hospital. So just give us an idea of where we are this morning. And yes, will they be able to be up and running again in 7 days or less now?
Good morning, Yuveka. Well, of course, there were those challenges that firefighters came across. One of them, of course, being that some of the fire hydrants didn't have any water for them to be able to use. So that's partly what caused, that delay in terms of the final extinguishing of that blaze. But we also know that what was difficult is that the firefighters couldn't get any access into the hospital where the hydrants there do have water. We know that the fire hydrants outside were vandalized, and that's why they needed access inside for the fire hydrants inside. But unfortunately, there was a structural collapse, and therefore they couldn't gain entry. But I do have with me Yuveka Kwarakekana, the spokesperson for the Gauteng Department of Health, in terms of the question on whether or not that 7-day mark is really realistic, or are we looking at extending it?
Good morning to you, Masego, and I think the viewers at home. Firstly, thank you so much to the media that's really been assisting us in covering, I think, the developments here at Charlotte Maxeke, and also just allaying fears of communities at home. I think that the 7-day period that the Premier communicated together with the MECs on Saturday is just about giving us enough time to make proper assessments with regards to the structural impact the fire has had on the facility, but also just maybe extending into various wards as well. Initially, what we communicated is that the fire was located, just in the basement towards area where what we call stores, which is also the storeroom area, that was mainly the affected areas. But of course, the fire went on from Friday into Saturday. We don't, as of yet, have the feedback from the team, the investigating officers, and the team from DID that's been assessing the structural damage and the impact from the fire there. So I think once they've taken us into confidence as where we stand, we might be able to then come back to the people of Gauteng to then say, where do we stand insofar as the structural damage and potential impact on the hospital, the wards and potential hospital services? What do we do from there?
Have you heard anything from the emergency services personnel working on the building on what caused the fire, and how much are we looking at in terms of fixing it? Do we know yet?
So the team from the city of Johannesburg, also from the South African Police Services, the investigating officers were on site from late yesterday afternoon. So that area now has been handed over officially to them to conduct all those inspections and the investigation to the cause of fire. We don't have that report yet. We also are waiting eagerly to understand what could have caused the fire. Insofar as quantifying the cost of damage and the equipment and other items that were in that storeroom as well, I think the priority for us in the last 2 days, Masego, you can just imagine, what we were grappling with was just ensuring the safe evacuation of patients. And as you can see around us today, the priority again is to ensure that staff members from this facility are then deployed to the other facilities where we've transferred essentially all the other patients from this hospital. Then we begin to look at those elements now once we have found comfort in the management of patients.
Now, Gwara, there's also the concern from some of the patients who've actually come here. I met a pregnant woman, for instance, who said she had a C-section that was supposed to be performed on her at 7 in the morning. People who had an appointment for chemotherapy being turned back, saying this was an inconvenience. What's happening with the communication to your patients?
So one of the things that we are concluding today, and hopefully we'll have this information and share it with the broader public and yourselves as well. And I did earlier on just acknowledge the role that the media is assisting us in also disseminating this information, and when that time comes, it's going to become quite important. Our priority now is to ensure that urgent surgeries are catered for, as well as scheduled C-sections. So the team led by Prof. Chauke has developed a plan We're just awaiting for them to cross the I's, dot the I's and cross the T's, insofar as giving us communication as to where those who have planned, C-sections are going to be admitted to, and then from there where these operations are going to be taking place. The hospital will be communicating, of course, directly with those patients, but of course as well, we will also be taking the public into confidence around those details in the event that, for example, might not be able to get hold of 1 or 2 patients. But we are trying as best as we can to close any gaps and to ensure that there isn't significant interruption of services beyond what we're already experiencing.
For that woman, for instance, who had that C-section due at 7 this morning, they told her to go to either Bara or Steve Biko. What will happen when she gets there? Will she be assisted, or are they going to prioritize other people who had already had appointments at Chris Hani Baragwanath?
So one of the things that we've done is also send through, sensitize our quality assurance teams just to ensure that the quality of service that we get at those facilities. I know, one of the things we're talking about is that on any given day, Masego, the health system in Gauteng is always overloaded and under pressure in terms of patients that are coming into our hospitals. And you can imagine taking more patients from this facility to other facilities as well. So beyond also taking, staff from here to other facilities to close those gaps in terms of patient management, that is crucial. But I think what we'll then do is that a clinical assessment will be made in terms of prioritizing patients. In any case, that's what we do in terms of, the triaging system, look at the patient that needs the care the most, and we'll start with those people. But I think those, these gaps, we're going to see them today, a bit of, teething problems also in terms of transporting our staff members to these various facilities as well. But it's things that we're really working on and closing those gaps as and when issues come about.
Well, thank you very much, Iveka. That is, of course, Kwarakekana, the spokesperson for Gauteng Health. This is, of course, quite a huge task in terms of the contingency plans. But I just want my colleague Mukhumuti Siduki to show you the promise that the vaccine area will still be operating. We can see there, that's where the healthcare workers will still get vaccinated. There was concern because this hospital is very important in terms of the fight against COVID-19, as well as one of the sites for vaccination. It is still operating because it's actually far from where the fire happened.
All right, thanks very much. Masego Rahlaga just bringing us the latest there from Charlotte Maxeke Hospital. And let's just cross our fingers that they can sort of get it together and get on with things in the next couple of days and clean up the way they say they can.